first one is concentration, which is obvious. We are expecting a hypnotized subject to be concentrated on something. Being suggestible, and dissociation is the third element of hypnosis. So the subject who is hypnotized is dissociated from the environment. He or she is concentrated, and he or she is suggestible. So, and suggestible means he or she is more receptive to suggestions. And that's the element, or that's the backbone of hypnotherapy. Hypnosis is not a therapy by itself. It's a platform for another therapeutic modality to be on top of hypnosis. So when if you hypnotize a patient and dehypnotize him or her, it doesn't have any therapeutic effect. But the important thing is to apply the appropriate or the proper suggestions under hypnosis. That's the most important part. So in the hypnosis, there are different phases. The first phase, you induce the hypnosis. In the second phase, you deepen the trance. And in the third phase, which is the most important part, you apply your therapeutic plan with suggestions. And it's very important that the therapist use the hypnosis for the conditions that he or she is qualified to deal with. So hypnosis is not a substitute for the medical knowledge. It's just an alternative to execute the therapeutic plan. And it's very important because hypnosis has a strong power to mask the pain. And if the pathology behind the pain is not known, for example, if there is a herniated disc or a serious pathology and you just mask the pain, that can be a really, really big mistake. Because sometimes if the diagnosis is not concrete, herniated disc can lead to like cauda equina syndrome or a lot of complications. So it's very important to diagnose first, then apply hypnosis. So suggestions are the backbone of hypnosis. People under hypnosis are more suggestible, more receptive to suggestions. There are also some hypnotic phenomena which are really, first of all, interesting, and they are also very, very important to apply hypnosis as a therapy. For example, people under hypnosis can experience analgesia. First of all, I have to say that people are different in terms of hypnotizability. Something like 5% of normal population are not hypnotizable at all. You cannot hypnotize them. And something like 25% of normal population are highly hypnotizable. And by highly hypnotizable, I mean they can experience a broad spectrum of hypnotic phenomena, and 75% of normal population are something in between. They are moderate or moderately hypnotizable. And when somebody is more hypnotizable, he or she can experience more hypnotic phenomena. One hypnosis phenomena which is relevant to pain and chronic back pain is analgesia. Hypnosis can mask pain, or at least the affective component of pain. You may have heard that some people can deal with or undergo or go through major surgeries just through hypnosis. I've seen some cesarean sections being done just by hypnosis, and the subject was looking at her belly and her baby. And just hypnosis, in some patients, something like 10% of normal population can go through a major surgery with hypnosis as an analgesic. Anesthesia, general anesthesia. Dissociation, which is a very common phenomenon in hypnosis. The subject feels he or she is dissociated from the environment. And catalepsy. Catalepsy, by definition, is a neurological condition characterized by muscular rigidity. You may see this picture. This lady is like fully cataleptic. And the important thing about catalepsy is the cataleptic limb does not feel pain. So if you can, and the good news is catalepsy is pretty common in hypnosis. So if your patient, if your subject is feeling catalepsy, for example, in one hand, The good news is, and the good thing is, that cataleptic limb does not feel any pain, and that's very important. And I have to say that this kind of hypnosis is not accepted. This one is not acceptable by the American Society of Clinical Hypnosis because they are so against stage hypnosis and recreational hypnosis. So I'm not, this is just to show you a case of catalepsy. So stage hypnosis is one of the absolute contraindications